A well-regulated militia being necessary to the security of a free state. The right of the people to keep and bear arms shall not be infringed. Welcome to another edition of Bearing Arms, Cam & Company. My name is Cam Edwards. I'm glad that you are with us on the program today. Coming up in just a matter of moments, going to be talking with Dr. Robert Young with Doctors for Responsible Gun Ownership about a brand new study showing that in the opening weeks of the pandemic, seems so long ago now, back in March, you remember when all those stay-at-home orders were starting to be issued and we saw the first surge in gun sales across the country? Well, a new study from the University of Toledo and the University of New Mexico indicates that a sizable number of those standing in line at their local gun stores were healthcare workers. Yeah, which kind of makes some sense if you think about it. I mean, if you, again, go back to where we were in March of this year and think about how scary it was, right? As particularly, if you were living in Seattle or New York City where the cases were spiking, the hospitals were, we were told, close to being overwhelmed. There was this grave concern that we were living in not just uncertain times, but we were living in unknown times. We didn't know what was going to happen next. And if you're working in the healthcare industry, you were probably more exposed to that than the average person who was, again, hunkered down in their home and still experiences it in a very different way. But it's not entirely surprising to me that we had a number of healthcare workers who were among those buying firearms. What does Dr. Young think about this? And what kind of impact might this have on the gun debate going forward if we have an influx of healthcare workers who are now exercising their Second Amendment rights? We spoke about it with a good doctor. Take a look and a listen. Dr. Young, thanks so much for coming to the program. It's great talking with you today, sir.
Great to be back with you, Cam. How have you been?
I've been pretty good. How about you?
Very good.
Excellent.
Aside from waiting through this pandemic, hopefully.
Yeah, absolutely. And, speaking of the pandemic, this is an interesting study that our friend Stephen Gutowski wrote about at the Washington Free Beacon. It's a study from a couple of different universities. I guess you've got the University of New Mexico and then the University of Toledo. Took a look at who purchased guns in the early days of the pandemic, the first few weeks of the pandemic. So they're not looking from March through October, but they're just kind of looking basically in March. And what they found was that being a healthcare provider was one of the strongest predictors of buying a gun during the opening weeks of the coronavirus pandemic. In fact, according to this study, some 67%, according to Stephen Gutowski, of the people who reported buying a gun during the pandemic also reported being healthcare professionals. Now, that number seems a little high to me, Dr. Young, but what do you make of the idea that as these lockdowns were going into effect, as the cases were surging in hospitals around the country, that healthcare professionals were among the most likely gun buyers?
I would never have assumed that to begin with, although in retrospect, after some personal experiences, I perfectly well understand that. There are two aspects to this, I guess, the profession and the immediate circumstances. And among healthcare, well, first of all, for healthcare professionals at large, healthcare personnel, this broad occupational category actually has the highest risk of being assaulted than any occupational category in America. This is something that the RGO has been concerned about always, and one of the reasons we so advocate that our co-professionals be equipped to defend themselves too, because they are the number one targets among all occupations. Within that, you find logically that ER personnel are the number one targets. People come in, they've been released generally from police management, and then it's up to the ER staff to manage them. Or some of these people are violent, or medical, metabolic, or psychiatric reasons, and they will strike. The other category of note, to me at least, as a psychiatrist, is that among physicians, psychiatrists are the most vulnerable and the most often targeted for assault by patients. That goes along with our reporting. Every time we hear about someone violent attacking someone's private office, a clinic, hospitals get attacked. That happens worldwide. So that's the background with which this study might be interpreted. We are at risk, and we should be arming ourselves.
Secondly, yeah, go ahead. I'm sorry.
Yeah, go ahead. No, it's okay. I'm going to get to the circumstances next.
Well, yeah, I was just going to ask. I mean, is this something that you've seen in your professional network over the past, again, 6 or 7 months? Have you had colleagues or individuals who kind of know you to be a pro-Second Amendment guy come up to you and ask, hey, Doc, thinking about buying a gun for the first time? Have you had any of those conversations?
Oh, sure. And I've always had those conversations, Ken. And I'm always willing to start a conversation if that's what too. Anybody I think might be open to it. Some of the places I would, of course, outlaw guns, but in private conversation, the people who are actually in charge of security shake their heads and say, "Oh gosh, it's a terrible policy if we didn't have to do that." So yeah, I have these conversations all the time. In my own experience, this is over the years, but I'm just one person. So multiply that by many, many, many thousands and thousands, hundreds of thousands of people in healthcare careers. One of my colleagues had a patient kill himself by shooting himself in his office. That easily could have gone either way. I had a patient, well, I was not present that day, but I had a patient who presented to the waiting room of the clinic I worked in, pulled out a knife and sliced his throat. Again, that could have gone either way. Either way, it's a tragedy. Either way, it's someone who brought a deadly weapon in to a vulnerable place where no one is protected and used it. So things like that happen all the time.
Yeah.
The circumstances I referred to then is what was the case at the beginning of this epidemic, March, April, as we were all discovering how awful serious it was. Now, a lot of New York City particularly asked for help. Healthcare professionals from around the country, and even more so from elsewhere in New York State where I live, answered that call and volunteered to come and work in New York City in the heart of the epidemic, risking themselves and their families with it, in order to serve the needs of all those people who are getting sick and for whom there were not enough steps for them there. A lot of them, of course, weren't familiar with the fact that New York City is essentially a no-gun zone for law-abiding people. Even in outstate New York, where I live, where it's easier, it is a distinctly different jurisdiction in those terms, and people may not realize that. So people, sometimes after they got there, and sometimes before they got there, started wondering, well, wait a minute, society is breaking down there. I want to go help. It's my duty. It's my mission, but can't I at least protect myself? And the answer, of course, was no in any substantial way. One of my patients is a nurse who went there at risk for herself. So other people I heard from in New York City who were already there.
Hey, Dr. Young, I'm sorry. Can I ask you to speak up just a little bit? You're getting a little quiet on us.
I apologize.
That's okay.
Okay. And people I knew in New York City already had that same concern heightened. So those are the circumstances. So with all that, I'm not the least bit surprised to hear that a lot of people in my segment of the vocational population have decided it really matters to be armed in order to protect themselves. I'm very glad to hear that.
What kind of impact do you think that this can have on the debate going forward? I know in this study, just looking, they did ask the question: do you think firearm laws in the United States should be more strict? Are they about right, or they should be less strict? And of those who did purchase a firearm, now this is not just healthcare professionals, but all those that they surveyed who did purchase a gun in the first couple of weeks of the pandemic. 57% said they thought that gun laws should be more strict. 35% said they thought it was about right. 8% said they thought it was less strict. Those who didn't buy a gun, 72% said that they thought we need more restrictive gun control laws. 21% said they're about right. 6% said less strict. So the support for gun control clearly less among those who purchased a firearm. You might expect that. But are we starting to see some discussions within the healthcare community about these what these gun laws might look like, and what exactly it is that people are advocating for? Are they still demanding the old school gun bans, magazine bans, universal background checks, those laws that ultimately are enforced by law enforcement officers that lead to arrests, that lead to prison time? Because it seems to me like more generally, we're starting to see maybe a little bit of a split even among gun control groups about what the priorities should be. Should it be those types of punitive measures, or should it be more, community violence intervention things that don't target legal gun owners, but actually aim to address those who are committing violent crimes?
Well, whether for political reasons right now or because it's sincere, we are seeing that the pro-restrictionist segments of our policy are tending to not to stop advocating gun bans.
Mm-hmm.
Don't know why. It's a good thing at the moment, and I hope they continue talking that way, because there are a lot of better approaches to reducing violence in this country, including having better armed and hopefully trained citizens. Now, your statistic is interesting to me because I was under the impression that in general, more and more people than that actually are starting to see that gun laws are already too restrictive as a function of so many people becoming new gun owners and often having trouble getting them. Your ear is close to the ground on the general data that I'm sure can. As to conversations in my profession, a really big one that BRGO is in the middle of is advocating not just for individuals in their individual practices and work being armed for defense, but the problem that we face with hospitals, big clinics, which have hundreds or thousands of patients and personnel who are essentially unprotected against the possibility of a terrorist event. These things have happened in hospitals all around the world.
Mm-hmm.
It's one of our special missions to try to convince our world that it's vital to protect with arms, with ideally trained people, but with staff if need be and feasible against that. Because even though hospitals are more locked down than usual right now, and we have just one or two entrances and maybe more, that's nothing to confront a couple cars pulling up with terrorists ready to die and kill anybody who stands in the way. And once they get into a hospital, it is over. They can kill anybody at will. That's a terrible gap in our preparation. That's comparable to schools not having armed defense. Although you don't see too many schools in one building with thousands of unarmed, often disabled victims of opportunity there.
That's absolutely right. Dr. Robert Young with Doctors for Responsible Gun Ownership. Thank you as always, sir. It is good talking with you today. I appreciate your insight, and I hope that we can talk again after the election. when we start to get a better idea of what we're going to be facing here in the months ahead in terms of protecting and defending our Second Amendment rights. But in the meantime, it's good talking with you today, sir. Thank you so much for coming on the program. Appreciate Dr. Young joining us on the program. Look forward to having him back in the near future. Right now, let's turn our attention to our armed citizen story of the day, our good deed of the day, our recidivist report. We will start there with a story out of Wausau, Wisconsin, where a teenager has been sentenced in a baseball bat beating of another teen. Yeah, and this teenager will not be going to jail for his crime. Nope, a judge sentenced Jordan Meyer to 6 years probation and no prison time. He could have faced 3 years in prison, and the judge says, listen, if you violate your probation, you're going to go to prison for up to 3 years, but Jordan Meyer spared any jail time in the beating of a 15-year-old boy with a baseball bat back in July of 2019. Meyer's accomplice, one of his accomplices anyway, Benjamin Dickerson, sentenced to 8 months in jail, followed by community service. Two other suspects in the case have their plea hearings scheduled for November 3rd and November 18th, respectively. The 15-year-old suffered some pretty severe injuries in that baseball bat beating. Again, one of the individuals responsible sentenced to 8 months in jail, and so far, one of them has managed to avoid jail time altogether. Our armed citizen story of the day from the Democrat and Chronicle in Rochester, New York, where a homeowner shot a burglar early on Tuesday morning in the town of Webster, New York. According to the Democrat and Chronicle, Webster Police Chief Joseph Rieger says officers were called to a home just before 1:30 Tuesday morning. Rieger said it appears that the homeowner, quote, encountered and shot an alleged burglar in an outbuilding. So this was not in the residence itself, but in a garage barn there on the property. The injured man suffered serious injuries, taken to a local hospital for treatment, where he's listed in a critical condition. Officers have not released the name of the burglar or the homeowner. They are still investigating, but at this point, looks like a case of self-defense. We'll keep our eyes on this story. We'll give you any more details as they become available. And finally, our good deed of the day. This story from the Tuscaloosa News in Tuscaloosa, Alabama, where a neighbor in the right place at the right time and willing and able to do the right thing to help save a woman from a house fire that just absolutely destroyed her residence. 67-year-old Kathy Griffin shared the mobile home with her daughter and grandchildren. There's not much left now, but she says that life would be even worse were it not for the actions of her neighbor. A neighbor, by the way, that she had never met. Yeah. Kathy Griffin says she reacted. I mean, she didn't know me or who lived in the home. She just reacted. And I may have seen the fire in time to have done something, but, I'd hate to think that I would have gone through that first hour by myself. Kathy Griffin lived in a home that belonged to her parents, who died a couple of years ago. She continued to live there with her daughter and 3 grandchildren. And back on October the 6th, she was at home alone in her living room, talking with one of her daughters on the phone. She saw a bright flash of light. She said it was like somebody out there with a big flashlight. I couldn't figure out until later that it was the fire. Meanwhile, a neighbor, 25-year-old Patience Giancaspro. I'm going to butcher this. I'm sorry, Patience. Patience Giancaspro. Yeah, Giancaspro. Smelled smoke as she was coming home from work. She said, I smelled it before I saw it. I started looking around. I could see the smoke, and I was freaking out. I was like, oh, my God. So I ran over there, and you could definitely tell at that point it was fire. It was definitely going. So Patience called 911. She beat on the front door, checked to see if anybody was inside. Nobody came to the door. Rather than just assume, all right, well, everybody's out, she then went around to the back of the home where the smoke was coming from to see if maybe there was somebody out trying to extinguish the blaze. Nope, nobody there. She returned to the front, kept beating on that front door until finally it was opened by Kathy Griffin. She said, I didn't know who she was. I didn't know who this woman was who was banging on my door. She said, I thought maybe she had an emergency. And it was me who had the emergency. One of Kathy Griffin's dogs inside the home, they were able to get the pet outside safely. Giancaspro attempted to retrieve Griffin's purse and car keys, but at that point, the home was too engulfed. She said, my heart was breaking for her. She is so sweet. She's a lot stronger, honest to God, than I would ever have been. And Patience stayed and comforted her neighbor as the first responders arrived. Kathy Griffin said she stayed with me. She brought me a chair to sit in, brought me a Coke. She was with me. She held my hand just like she had known me forever. She said, I don't know. I just felt secure. Patience did it again. Sorry, Patience. Patience Giancaspro moved to Cottondale about 4 months ago from the Gulfport, Mississippi area. She was actually a volunteer firefighter for about 2 years, about 5 years ago. She said there was a different experience, though, but she'd never been with somebody like Griffin, watched them as their property burned down. She said, all I wanted to do was listen to her talk. She said it seemed like that would be the best way to help Griffin cope with the situation. She said, I think that way she didn't lose it all at once. All I could think about was her and what she was going through. Well, since that fire, Kathy Griffin says that she has just been overwhelmed with the response from the church community that she has and the members of the Cottondale community. Fundraiser created to benefit Griffin and her family. So far, more than $2,000 of the $3,500 goal has been raised. And friends, church family, and others have pitched in to help do repairs on a mobile home that she lived in before she moved into the home that was occupied by her parents. So hopefully life is going to turn around here soon for Kathy Griffin. And in large part, I think it is because of the efforts of that neighbor who she'd never met, Patience Giancaspro. I did it that time, Patience. In the right place, at the right time, willing and able to do the right thing. And we thank you for your very good deed. That is all the time we've got for you on this edition of Bearing Arms Cam & Company. Want to thank you for being a part of the program as well. Now, coming up on tomorrow's program, we're going to be delving into the rumors of more shenanigans by the ATF. Are they getting ready to simply ban all pistol braces and all AR and AK style pistols with braces attached? Going to delve into that discussion on the next edition of Cam & Company. Until then, don't forget, you can follow us, subscribe to Town Hall Media on YouTube or Spotify, SoundCloud, Stitcher if you want to get the audio version. We'll be back tomorrow. Until then, be well, be safe, be free, and we'll see you soon with another edition of Bearing Arms Cam & Company.